Hello, my name is Vincent Dubois. I'm a consultant ophthalmologist who specialises in cataract and glaucoma in the northwest of England. Today I'm going to talk to you about glaucoma. What is glaucoma? Well, glaucoma is a disease of the nerve fibres at the back of the eye. These are the fibres of nerves that carry light signals from the eye to the brain and create what we call sight. So if the nerves are diseased, then you don't see as well as you should, and this is what we call glaucoma. So unfortunately for early glaucoma, there are no symptoms at all in many cases. And that's why the moniker for glaucoma is the silent thief of sight. Because by the time you are aware of a problem, it's often too late. The best thing you can do to ensure that you don't suffer from glaucoma is to see an optician regularly, typically every 2 years. They will do a couple of basic screening tests, such as blow air in your eye, which everybody hates, but is very useful. And they'll also do a short field of vision screening test. And these two tests are very powerful in picking up early mild disease. If your optician thinks you may be at risk of glaucoma, then they'll often send you to see an eye specialist in a hospital or clinic. At this point, you'll have a more in-depth assessment, often including detailed scans at the backs of the eyes, a detailed field of vision test, assessment of the drainage angle in the eye, and another pressure measurement. With all this information in place, your specialist will either say that you're fine, and it's a false alarm, which is reassuring, or they'll say that you either have glaucoma or are at risk of developing glaucoma. At this point, you'll either be monitored to see if anything changes, or you'll be offered treatment for your condition. Treatment consists of one of three things, used in combination or alone. So the first is medication, and this is usually eye drops. The second is laser treatments. We have typically 2 or 3 laser treatments that we use for glaucoma, and 2 of them are delivered in the clinic as a consultation with you seated on a normal examination type machine. The third treatment option is surgery, but you must remember that 9 out of 10 people with glaucoma or glaucoma-associated conditions do not require surgery. This means that your condition is often controlled or stabilized with eye drops and or laser treatments. So that means that 1 in 10 people goes on to have surgery, and there are many different operations you can have. Some of them only take 10 minutes, some of them might take as much as a couple of hours, and there's quite a lot of discussion to be had around which might be suitable for you. Ultimately, if you have your glaucoma picked up early, and you come for your assessments and your monitoring, and you take your treatments in conjunction with discussions with your eye surgeon, then glaucoma is usually something that you live with rather than suffer from.